Hello, everyone. In this short presentation, I'm going to cover three topics, which are the ECG, the heart sound, and the cardiac cycle. So let us get started. Um, Electrocardiogram or ECG, sometimes called EKG, is a recording of electrical changes that occur in the myocardium during the cardiac cycle. So it is very similar to EMG and EEG, which record also the electrical activities at the level of muscles or the brain. And it is used to assess the ability of the heart to conduct the impulses. So when we do ECG, we'll find like three types of waves. Okay, and as you know that each muscle, the atria and the ventricles, undergo two main stages of contraction, which are depolarization and repolarization. So both atria and ventricles should reflect these two phases in the ECG readings. So regarding the atrial depolarization, uh, this is reflected by a B wave. So B wave is mainly recording the atrial depolarization and occurs just prior to atrial contraction. Okay? The QRS complex represents the ventricular depolarization and it occurs just prior to ventricular contraction. Okay, so where can do we find the atrial repolarization? In reality, the atrial repolarization is hidden in the large QRS complex, since the ventricular depolarization is a much larger event. Okay, so it starts by atrial depolarization, then the repolarization is hidden within the QRS complex because it is uh, a large event. Okay, and finally we have the ventricular repolarization that occurs just prior to ventricular relaxation. Okay. To understand these three waves, let us have a closer look into this diagram, which shows in the left part here, this is the heart, and here are the atria, lower down are the ventricles. And as we said, the B wave, which is the first wave to appear in the ECG, this is the ECG readings, okay, represent the atrial depolarization. Okay, so here the atria started to depolarize, and then here in the ECG the readings started to appear as B wave. Okay, then after that the atrial repolarization occur, but because of the strong and the important event of ventricular depolarization which take place, the atrial repolarization is hidden. Okay, so the QRS, which is here, represent the ventricular repolarization that occurs just few seconds before the ventricular ejection. Okay, and so the QRS represent ventricular repolarization, and the T wave, which is here, it represent the ventricular repolarization that occurs after the ventricular ejection or systole. Okay, so this is now a normal ECG, which is representing reflecting the electrical uh, movement or contractility within the heart, both atria and ventricles. So we have B wave, QRS wave and T wave. B represent atrial depolarization, QRS represent ventricular depolarization, and T wave represent ventricular repolarization. Now, after we understand the concept of ECG, let us have a look also to the heart sounds. And the heart sounds or heartbeat, uh, a heartbeat through a cystoscope sound like lop dop. So when we put the cystoscope in the heart, we hear this sound of lop dop. Okay, uh, these sounds are due to closure of the heart valves. So we have two types of heart valves. We have the atrioventricular heart valves, which are tricuspid, bicuspid, or mitral, and we have as well the semilunar valves, which are aortic and pulmonary. Okay, so LOP occurs during AV valve closure, and DOP occurs during semilunar valves closures. So let us see what is LOP. LOP is the first heart sound, and it occurs during ventricular systole. Okay, why? Because when the ventricles become full of blood and start to contract, systole means contraction. So when they start to contract, at this time, at this point, the AV valve closes in order to prevent the backflow of blood from the ventricles into the atria. Okay, so during this time, the valves close and they produce this sound of lop. Okay, and the dub, which is the second heart sound, referred to as S2, it occurs during ventricular diastole and is associated with pulmonary and aortic semilunar valves. Yes, after the blood is ejected from the ventricles, after that the ventricles goes into relaxation and the pressure inside the ventricles drop. That is why the AV valve, sorry, the semilunar valves closes, okay, to prevent backflow of blood from the aorta and pulmonary trunk into the ventricles. So the sound of the closure of the semilunar valves will produce the second heart sound, which is dub. Okay, so both of them are due to closure of valves. AV valves, lub, and semilunar valves, dub. Okay, so we call this S1, and the other one is S2. We have sometimes abnormal heart sound, which is called murmur. So murmur is an abnormal heart sound that is derived from incomplete closure of the cuffs, and this will lead to leakage of blood. So, for example, if you have, let me say, tricuspid regale, so when the right side of the heart contract to eject the blood into the pulmonary trunk, some of the blood will uh, get through the atria, through the AV valve, through the tricuspid valve, leading to this abnormal heart sound, which is called murmur. So here, the diagnosis can be tricuspid regurgitation. Okay, so normally we just hear the dub sounds, but if we hear this abnormal sound, that means there is a problem in the valves. Okay, so where do we can put the cystoscope to hear the dub? We can hear the valve sounds or first and second heart sounds better. If we want to see here, sorry, the aortic valve, we can put the cystoscope in the right second intercostal space. As you see here, this is the first intercostal space, this is the second intercostal space. So uh, if you put the cystoscope in the right second intercostal space, which is right to the sternum, directly right to the sternum, you can hear the second heart sound beta here, which is dub. As well, if you put it in the right side, sorry, in the left side of the sternum, in the second intercostal space, you can hear also the pulmonary area, and in both of them you can hear the first and second sound, heart sounds, but you can hear the second heart sound better than the first heart sound. Okay. Regarding the tricuspid valve, if you want to hear the tricuspid valve, as you know, this is a void process. So in the fourth intercostal space left to the sternum, you can also hear the lob sound better than the dub sound, or the first heart sound. You can hear it better than the second heart sound here. And if you want to hear the mitral valve better than the other valves and the first heart sound as well, you can also hear it here at the fifth intercostal space, mid-clavicular line. So this is the site of the apex. We talked about it last time. So we can, if you put the cystoscope in the apex, this will help us to hear the mitral valve. So when you put the cystoscope, you can hear the heart sounds better up here in the second intercostal space, right and left. You can hear the second heart sound better, and lower down here in the fourth and fifth intercostal space, you can hear the first heart sound better. And not only that, you can also specify if there is a problem in each valve. So if there is a problem in the aortic valve, can also be auscultated here. Pulmonary valve can be better auscultated here, and so on and so forth. In this diagram, we can study also uh, the different changes that take place during the cardiac cycle. So this is the systole and diastole, okay, for both atria and ventricles. And here, this is a pressure. This is the pressure of the blood vessels, and it is mainly a reflection and due to pressure in the ventricles, okay. So when the ventricles enters in the ventricular diastole, uh, the pressure dropped to 80 millimeter mercury, and during ventricular systole, the pressure increase and reach up to 120 millimeter mercury. Okay, and also here, uh, this is the ECG. So here, this is atrial depolarization. So this is atrial diastole and then atrial systole. Okay, uh, followed by ventricular depolarization, which is just seconds before the ventricular contraction, which is QRS wave. And here, this is a site of ventricular systole, followed by ventricular diastole, which is represented by T wave. Okay, and as you know, when the atria eject the blood into the ventricles, 70% pass passively, but the 30% of the blood ejected from the atria into the ventricles due to atrial systole or contraction. Okay. After that, the pressure in the ventricles increase and increase until it lead to opening closure of the AV valves. So closure of the AV valves will produce the first heart sound, which is lub. After that, the pressure increase more and more in the ventricles, leading to ejection of the blood into aorta and pulmonary trunk. Okay, so we call this ventricular systole. After that, the pressure drop in the ventricles, and the aortic and pulmonary trunk valves, which are the similar valves, they close, okay, due to this drop in pressure in the ventricles. So closure of the semilunar valves will lead to the second heart sound, which is the dub, okay. So this is a very comprehensive um, diagram showing the blood pressure, showing the changes in the ECG, in the atria and ventricles and the different waves, and as well showing the heart sounds that occurs due to closure of the valves. Okay, so pressure and volume changes in the cardiac cycle. During the cardiac cycle, the pressure of the heart chamber rises and falls. Okay, so we have systole and diastole. Sometimes the valves open, sometimes the valves are closed. Due to these changes, the pressure inside the heart uh, rises and falls as well. So pressure changes open and closes the valves. The pressure is responsible for opening and closing of the valves. So these are the different phases uh, where the heart and the atria and ventricles go through. So early have early ventricular diastole, which is relaxation of the ventricles, and during this stage, for sure, the ventricles are relaxed and the pressure is lower than the atria. Okay, and at this time, the AV valves are open while the semilunar valves are closed. And as I said, like 70% of the blood flows passively from the atria to ventricles in both atria, right and left atrium. Okay, so we call this stage early ventricular diastole. Okay, because still the ventricles are in diastole in relaxed stage. This stage is followed by atrial systole and still ventricular diastole. Okay, so we have 30% of blood is still remaining in the atria, so the atria will contract to push this blood into the ventricles, and again during this phase still the AV valve will be open, okay, and the semilunar valves will still be closed. So this will lead to increase in the pressure of the ventricles. The third phase, which is ventricular systole and atrial diastole. Never ever both atria and ventricles contract together. So when the ventricular systole starts, the atria should be relaxed in this time. So when ventricular pressure rises above atrial pressure, in this case, the AV valve closes. Okay, and we just mentioned this. When the ventricular pressure increase, this will lead to closure of AV valve. And if you remember, when we talk about the heart anatomy, we have muscles inside the ventricles. These muscles are called papillary muscles. They are connected to the valves, tricuspid and mitral valve, by what is called chordae tendineae. So these chordae tendineae prevent the cusp of the valves from bulging back into the atria, while the blood pressure is uh, increased and the pressure is increased. Sorry, the pressure is increased inside the ventricles. Okay, so in this stage, the atria are relaxed. Okay, and the blood flows into atria from the vena cava and pulmonary veins because they are now in atrial diastole, but the pressure will continue increasing in the ventricles, and this will lead to opening of the semilunar valves and the blood flow into the pulmonary trunk and aorta. Okay, but this can easily be explained in this diagram. So here this is early ventricular diastole, where the blood flows from both atria into the ventricles, like 70% of the blood pass passively. During this phase, both atrioventricular valves are open and the semilunar valves are closed. Okay. After that, the ventricles goes into ventricular the atria goes into atrial systole and still the ventricles in ventricular diastole. Okay, still the ventricles, the AV valves are open, and the atria will contract to eject the remaining 30% of the blood into the ventricles. Okay, after that, the pressure will increase and increase in the ventricles. This will lead to closure of AV valve, atrioventricular valve, the mitral and tricuspid valve. Okay, and the atria will be in diastole phase, which is relaxation of the atria, and during this phase, a lot of blood will shed into the atria from superior and inferior vena cava or pulmonary veins. Okay, after that, the pressure will continue increasing in the ventricles. This will lead to, as I said, closure of AV valve and opening of semilunar valves, and after that the blood will be ejected into aorta and pulmonary trunk. Finally, the pressure will drop into the ventricles, and due to this drop in pressure, the semilunar valves will close, leading to the second heart sound, and as well the tricuspid and mitral valves will open. Okay, and the cycle will continue. We call this cardiac cycle. Cardiac cycle. So this cycle is regulated by many factors and regulated also by a center. The center is found in the medulla oblongata, which is part of the brain stem. Okay, so this center regulates the cardiac cycle through its influence on the sinoatrial node or SA node, which is the pacemaker of the heart. We talk about it when we describe the conductive system of the heart. So the cardiac center is affected by sympathetic and parasympathetic. Okay, so when the blood pressure increase, or decrease, the cardiac center will send impulses to the SA node to accelerate the contractility of the heart rate, or to decrease the heart rate. Okay, just to uh, control and regulate the blood pressure. So sympathetic and parasympathetic are the main factors that affect the heart cycle or cardiac cycle. Okay, also there are other factors that affect both sympathetic and parasympathetic, like physical exercise. Whenever there is physical exercise, this will increase the heart rate uh, and increase the uh, cardiac output as well. Okay. Also, in case of high blood pressure, high temperature, this will lead to increase the heart rate and the cardiac cycle as a whole. And also during fight and flight, this, as you know, will stimulate the sympathetic system, and this will also increase the heart rate. And also the ions such as potassium and calcium, both of them will lead to changes in the cardiac cycle, and they may lead to arrhythmia. So, what are the factors that, as I said, they influence the SA node and the cardiac center in the medulla oblongata? These are sympathetic and parasympathetic. The parasympathetic in general keep the heart rate and the heartbeats between 60 to 80. Okay, so it decreases the heartbeat uh, below 100. Okay, and the sympathetic doing the vice versa. It increases the heart rate up to 100 and even more than 100. Okay, so we have a very important structure which is called baroreceptors. These baroreceptors are a group of receptors, stretch receptors, found in the arch of aorta, and as well found in the at the site of division of common carotid artery. Common carotid artery will an artery which is a branch from the aorta will divide into external and internal carotid arteries. So at the level and the site of division, we have baroreceptors. These receptors, which are found here in the arch of aorta, as well here in the division of carotid, common carotid into external and internal, we call them carotid sinus. So we have aortic baroreceptor and carotid sinus. Aortic baroreceptors and carotid sinus are stretch receptors. So whenever we have high blood pressure due to increased heart rate and blood volume, this will be detected by the stretch receptors in both the aortic baroreceptors and carotid sinus, and this will send afferent information into the cardiac center in the medulla oblongata, which is going to send inhibitory stimuli to SA node and AV node in order to reduce the heart rate, cardiac contractility, and as well the blood volume. Okay, and whenever we have drop in blood pressure, this is also going to be detected by these two receptors, the aortic baroreceptors and carotid sinus, and the message will be sent to the cardiac center. And this cardiac center is going to send other information through the sympathetic system to the SA node and AV node, and this will lead to increase in the contractility of the heart, increase heart rate, increase the blood volume, increase the blood pressure until it reach the normal. Okay, so we have receptors here and here that detect high blood pressure or high hypotension, low blood pressure. They send messages to the cardiac center, and from the cardiac center through sympathetic and parasympathetic, they send nerve supplying impulses again to the SA node and AV node to increase or decrease the heart rate and cardiac output. Okay, so this is the effect of baroreceptor and its role in control and regulation of heart rate and blood pressure. Also, the hypothalamus and the cortex, they have also role in controlling and regulating blood pressure, because if there is any anxiety or stress or um, external effect, psychological effect, this will be affecting both the hypothalamus and the cortex, and again this will influence the cardiac center, the medulla oblongata, which is going also to influence and affect the SA node and AV node. Okay, we talk about the baroreceptor reflexes in case of hypotension and hypertension. We also have some stretch receptors found in the vena cava. Okay, these receptors, in case of increasing blood pressure, um, the sympathetic cardiac accelerator reflex increase the heart rate and force of contraction to lower the venous pressure. Okay? So whenever we have venous pressure, this will stimulate the sympathetic nerves supply to increase the heart rate to lower the venous pressure. Also, we have other factors, as I said, which are impulses from the hypothalamus and cerebrum. These are mainly psychological, and body temperature. Whenever the blood pressure, the temperature increases, this will also lead to increase in the heart rate, and the level of potassium and calcium. As I said, both of them will change the heart rate and may lead to arrhythmias. So, generally speaking, we can say that the cardiac cycle is affected by many factors, mostly sympathetic, parasympathetic, the baroreceptors, which controls the blood pressure, and also stretch receptors that are found in the vena cava, and other factors like impulses from the hypothalamus and cerebrum, body temperature, and the level of potassium and calcium. Finally, we have some clinical applications. So the cardiac cycle, we have the concept of arrhythmias, and arrhythmias means altered heart rhythm. Okay, so the heart has a rhythm which is lub-dub, lub-dub, lub-dub. Okay, and this heart sound and rhythm occurs in a very rhythmic manner, very well controlled and regulated rhythmic manner. Okay, but whenever you have any disturbance in this rhythm, this will lead to what is called arrhythmias. Okay, and before diving into arrhythmias, you know that you have normal heart rate, which range from 60 up to 90. Less than 60, we call this bradycardia, and more than 90 or 100, we call this tachycardia. You have also what is called premature beat, and these are the beats that occur before expected normal cardiac cycle, and probably it is generated from different regions apart from the SA node. Okay, we have the concept of atrial fibrillation. Atrial fibrillation or fibrillation can occur in the atria or in ventricles, but in atria it is not that serious like in ventricular fibrillation, because ventricular fibrillation is mostly fatal. So what is fibrillation? Fibrillation is uncoordinated and chaotic contraction of small areas of myocardium. And the problem of fibrillation is that it does not allow the chambers to be filled with blood and the heart to eject sufficient amount of blood. So the cardiac muscles contract and contract chaotically and in uncoordinated manner. This will lead to insufficient time for the chambers to be filled with blood, and this is very serious. It will affect the blood pressure and affect the organs, perfusion, and so on and so forth. We have also what is called flutter. And flutter is a rapid, regular contraction of the heart, more than 100, 220 up to 300, 250 up to 350. Okay, beat per minute. So it is like also sort of arrhythmias, and we have also ectopic pacemakers, which is occur due to damaging the SA node. So the AV node will try to take over, and this will affect the number of beats per minute. Instead of being 70 to 80 or 60 to 90, it will be between 40 to 60. And lastly, you have the issue of artificial pacemaker, which is a device that is used to treat disorders in the cardiac conduction system. It can be implanted, and it has a battery power, okay, just to make sure that it is working, and it controls and regulates the heart beats, and it make it rhythmic. Okay, we'll stop here and continue in other